The question is that the amendment be agreed to, and I call the member for Werribee.
Thanks, Deputy Speaker. I rise to make my contribution to the National Health Amendment Cheaper Medicines Bill 2025. Well, we've done it again. The Albanese Labor Government is making cheaper medicines even cheaper. This bill reduces the Pharmaceutical Benefit Scheme general patient co-payment from $31.60 to $25 on the 1st of January next year. This is delivering on the Albanese Labor Government's 2025 election commitment. $25 is the lowest Pharmaceutical Benefit Scheme medicines have cost in over 20 years, and it is another key cost of living measure delivered by our government. We've already delivered some major reductions to the cost of medicines. That was in 2023, when we made the largest cost to the cost of medicines in the history of the PBS. And now our government is going even further. This is more than a 20% cut. This is more than a 20% cut in the maximum cost of the PBS medicines. This will save Australians over $200 million a year. In fact, Werribee residents have already saved almost $8 million since the first changes in cost occurred. Making medicines cheaper in a tangible way is the way that we are helping families with cost of living relief. 4 out of 5 Pharmaceutical Benefit Schemes medicine will become cheaper because of the $689 million investment by the Albanese government. Pensioners and concession card holders will continue to benefit from the freeze to the cost of their Pharmaceutical Benefit Scheme medicines. And what we need to remember is if you need a diabetic medication, an asthma puffer and blood pressure medication, at the moment it can cost over $100 a month for these. This change of a reduction of $7 a script will mean $20 more in your pocket each month. And for some people who take multiple medicines, this will be even more. The Assistant Minister just spoke about what it was like to be in a community pharmacy and deal with mums and dads who needed multiple prescriptions filled. There was a time when I was that mum. I had 3 children who had asthma, and this time of the year is the worst for them because they get a cold or they get a secondary bacterial infection, and you end up at the pharmacy with 3 prescriptions each to be filled. Back then, they're a little older now, but back then that could have been the best part of $150 and $200. That is a huge amount out of anybody's housekeeping that you're not expecting. So putting money back in people's pocket is just what this legislation will do. The cost will be frozen the cost will be frozen for pensioners as well to $7.70 until 2030. So, and for the first time in 25 years, co-payments are not rising with inflation. This builds on action we've already taken to deliver cost of living relief through cheaper medicines. This includes a 25% reduction in the number of scripts a concessional patient must fill before the Pharmaceutical Benefit Scheme safety net kicks in. We've introduced 60-day prescriptions, saving time and money for millions of Australians with ongoing health conditions. The Pharmaceutical Benefit Scheme began in 1948. And surprising to no one, it was under a Labor government led by Ben Chifley. I fear that most modern history forgets Mr Chifley's achievements and the monumental work he did following World War II. But I think it's quite fitting when you type Ben Chifley into a search engine. He's stated as being a train driver and former Prime Minister of Australia. Mr Chifley, in the great Labor tradition, put in the work to make systems fairer for those who needed it most. And the Albanese government made it clear to everyone that for us, health is a priority, plain and simple. And it's also a right that everyone in this country should have good health care. And every effort needs to be made to remove any badges to assessing medical help. For everyone, health is an important issue. Even if you have good health, you may care for loved ones, family, friends, or just others in the community that that will be affected by these changes. So this is something we really should do. I've spoken to a number of local pharmacists and constituents who've told me time and time again that they've had trouble paying for medicines, or that the pharmacists have to give advice about which medicine is the most important. The reduction of the $12.50 in 2023 and this reduction from the 1st of January means that community pharmacists will not be as distressed when they have to give this advice, because the advice won't be as necessary. These changes will make so much of a difference to those who need medicines every week. We've made the massive $6.1 billion investment in Medicare as well. We're rolling out $1.4 billion investment in Medicare urgent care clinics, so 4 in 5 Australians will live within a 20-minute drive of a Medicare urgent care clinic. And as of this week, we have announced that the tenders have been sent out for the Medicare urgent care clinic in Green Valley, in my electorate, which was also an electorate commitment for my community from the Albanese government. I'm so excited that the tenders are out, and we are really hoping to see that opens in the very near future. Also in my electorate and all around the country, we're rolling out Medicare mental health centres. These will provide support for people who need walk-in help at any time with their mental health. We've invested $174 million to increase the Medicare rebate for common pathology tests for the first time in 24 years, as well as adding PCR tests for COVID-19 and other respiratory illnesses to Medicare. Medicare is one of Labor's greatest achievements, and that's why we continue to strengthen it, and that's why Australians nationwide put our trust in us at the last election. They saw what we've done and what we've promised to do, and we have runs on the board to make sure that people's health is forefront in what we provide. They agreed to join us on this journey, ensuring that we uphold the values that makes this country the envy of the world. Australians have entrusted us to protect Medicare and the Pharmaceutical Benefit Scheme, and to strengthen Medicare and that scheme. Today we take another step on that journey, and today we make the system fairer for everyday Australians. Today we provide much needed relief for our most vulnerable. I commend the bill to the House.